Hello, I'm Keiser, your state senator from the 33rd Legislative District, which includes Burien, Des Moines, Kent, Normandy Park, and SeaTac. The closing of the first phase of this year's legislative session is upon us, and I am pleased to report that many key health care bills have now passed out of committee and will continue to move forward in the legislative process. Among my top priorities is a bill to increase oversight and patient protections at adult family homes. Heartbreaking stories of patient neglect and mismanagement prompted me to push for new standards and higher levels of performance in these facilities. Passage of this bill is critical for the protection of our most vulnerable citizens. I've also introduced legislation to pursue improvements in prosecution of Medicaid fraud. I was shocked to find our state ranked among the lowest in fraud recoveries and proposed this bill to improve the performance of our Attorney General's Medicaid fraud unit. With passage of this legislation comes the potential for hundreds of millions in savings. A proposal to address acceptable levels of immunization in elementary schools is also advancing. Currently, our state has a very easy opt-out for parents who don't want to bother with immunizing their child when they enroll their kids in kindergarten. This bill would require that a parent be informed of the risks and benefits of immunization by their health care provider. Legislation to more carefully regulate the medical use of marijuana is also advancing. The bill would authorize the licensed distribution and ensure that growers are regulated. Currently, patients using medical cannabis have a very difficult time finding the product, and they are often at risk of arrest. This bill addresses those concerns while providing critical regulations to protect public safety. I'm also very pleased to announce the advancement of legislation to establish a Washington State health exchange in order to implement the federal health care reform law. This bill is critical to the future of health care for the citizens of Washington State, and I am committed to fighting for its passage. Without it, Washington may be forced to forego millions in federal aid for our already troubled health care system. These are just a few of the key pieces of legislation that have advanced through the Senate Health Care Committee thus far. As the coming weeks unfold, I will keep you up to date on their progress and the progress of numerous other proposals to help create a better Washington. As always, it's an honor to serve you. Until next week.